Hi, I'm Dr. Rabab Zaidi. I'm the general dentist here at Dr. Rami Hamid Center. And today I'll be talking about a topic which is, I think, very common now because most patients or most people are very interested in having that Hollywood smile. So I'll be speaking about tooth whitening or tooth bleaching. Both of them are the same. So basically, tooth whitening, it's a simple procedure, and it can take from 45 minutes up to an hour depending on the severity of your staining or tooth discoloration. And we use two bleaching agents. It can be either of them. It's either carbamide peroxide or hydrogen peroxide, but they basically do the same thing. So what the concept is that these bleaching agents will break down the stain in your tooth into smaller pieces so that basically it's not as concentrated, so your tooth will then appear whiter. Most people do ask how their teeth got to be so yellow or so brown, depending on whatever the color of the stain is. So mostly it's something that you will do from your daily activities, such like from food and drink. It's the most common. For example, if you're a tea drinker or coffee drinker, you're definitely going to have a lot of staining, and and also red wine, for example, and foods that can have what we call chromogens, which are basically color pigments that are quite strong and they go and stick to your tooth. So this is one of the most common reasons for having tooth discoloration. The second most common is actually smoking. So we do get smokers that come to us and they ask, why are my teeth discolored? And it's simply because you're smoking. So the tar and nicotine in a cigarette it's a very strong stain causing situation. So that's also one of the reasons. Other than that, there's age. As you get older, your teeth will actually become yellower, and this is quite normal because as you get older, the outer white layer of tooth becomes thinner, so the inner yellow layer will start showing. So age is also a common factor. And other than that, you have several medications that can do that. Some antibiotics do that, some antihistamines. Chemotherapy will also do that. So there are many reasons that you can have tooth discolorations. If tooth whitening will work for your teeth, and does it work for all teeth? The answer is no. And if there is any dentist that will tell you that tooth whitening works for all teeth, they're not being very honest. So you need to find a dentist who is well-trained, who can be honest with you and tell you whether tooth whitening will work for your particular case or not. For example, yellow stains, they do respond quite well to teeth whitening, and you'll be quite happy when you leave the dental office. And on the other hand, brown or grayish discolorations, especially those from trauma, like if you fell down or something, these are not going to respond very well to conventional in-office bleaching or tooth whitening. So you basically have three options for tooth whitening. One of them is a toothpaste, a whitening toothpaste. However, a whitening toothpaste will not penetrate very far into your tooth, so it will only remove surface stains, so it's not actually going to make your tooth much whiter, so you will be disappointed if you're expecting a very drastic effect. The second option, which is the most effective, is the in-office bleaching or tooth whitening, and this is done at the dental office, and like I said, it can take up to an hour. And this is the most effective for most cases. And other than that, you do have the at-home bleaching, which is either the strips that you can get at the pharmacy or wherever, or it comes in a gel form. You put it in a tray overnight. So there are the three options. Normally, they're very mild, and the most common one is that you will have tooth sensitivity, but this is temporary, so it'll fade away over time. And most importantly, you should follow the instructions given to you by your dentist about what to do post whitening, so that you can get the best results and long-term results.